After priming the blood bag, it is now time for you to close the running plane NSS. You have to close the regulator, but before that, you have to move this regulator downwards near the patient's IV tubings or piggyback here. So you have to move this. Then afterwards, you close the regulator. So the purpose of this is that when you hook the blood here on this area, then the blood would not backflow here because the regulator is on this side. So after when you are done, you're going to disinfect this portion here where you're going to hook your blood. So you disinfect. So some institution, they have needleless piggyback wherein you just have to remove the needle like this. And you just connect it without a needle. But for this set, since it's not needleless, then the blood tubings has to be attached with a needle. So you remove the coverings, then you insert the needle just like this. Then afterwards, you need to apply plaster. So after attaching this to the piggyback, you have to secure the connection with a plaster, because if not, then the connection would be dislodged and the blood products would be wasted. So after closing the regulator and after applying plaster to making sure that the connection is really fixed, then it is now time for you to open the regulator and to start the transfusion. In starting the transfusion, you don't have to regulate as the ordered rate. You have to start with a very slow rate. So it is 10 to 15 drops per minute. Very slow with your watch counting. If it is 15 drops per minute, then after opening the regulator with 10 to 15 drops, you have to stay with the patient for 15 minutes and observe for any signs of blood transfusion reactions, like your difficulty of breathing, presence of itchiness, signs of edema, or any signs of blood transfusion reactions. After 15 minutes, if the patient does not develop any blood transfusion reactions, it is now time for you to regulate the exact drops that the doctor has ordered. Usually, the doctors do not order the exact drops per minute. They will just order to run for 4 hours. So you have to take note the amount of blood, how many ml of blood is inside the blood bag, and you have to calculate the number of hours that the blood will be transfused. For example, it is 250 ml and it should run for 4 hours. You have to calculate that using your drop factor rate. After getting the exact drop factor rate, you have to regulate. Sir, nag-start na itong transfusion. So, pwede radyo kayo kung imutawgon if na kayo na-observeran ng mga unusualities. Then, from time to time, kaya ako tingnan i-check with your vital signs para ma-check na itong imong condition. Okay ba nimo, sir?
Yes.
This blood product, sir, will be transfused for 4 hours. So, nag-start matag 10 a.m. So, mahuman ni siya around 2 p.m. Noted, sir?
Okay.
Okay, sir. Thank you. Once the blood is already consumed after 4 hours, you have to stop the transfusion. So you have to close the regulator. After that, you open the plain NSS line. So you have to open the regulator. Then you have to move this regulator upwards. So you move. And then you regulate at the desired rate or regulate the previous rate of your blood transfusion. So if it is 10 drops per minute, then you regulate 10 drops per minute. After that, you have to remove the piggyback blood bag. So you remove the plaster. So be careful with the needle, then you have to remove. So after removing the blood bag, you have to clean the injection port with a cotton ball with an alcohol. After that, you turn on the regulator.